I'm Linda Elsegood, founder of the LDN Research Trust. It has been my honour to interview LDN researchers, prescribers, pharmacists and patients from around the world for many conditions. Thank you for joining us.
I'd like to introduce Dr. Jill Carnahan from Colorado in the United States. Thank you for joining me, Jill.
Thank you, Linda. Delighted to be here.
Could you tell us when you first heard about LDN?
Boy, I'm always looking for cutting-edge things that will help my patients, and sometimes even though they don't yet have randomized controlled trials, they're very promising, and as long as the safety is there, I'm willing to try. So I'm thinking probably 5-6 years ago is when I first heard about LDN.
Mm-hmm. And did you start using it straight away on your patients, or?
I think I first talked to colleagues and got some, feedback as far as other people who might be using it. There wasn't that many doctors using it, even in the realm of integrative and functional medicine, which is kind of my world. So then I would talk to patients and just, give them informed consent and say, this is experimental. Here's the benefits. Here's the pros and cons. And several people were very interested in trying that. So I just went ahead and started using it right off, probably about 5 years ago for the first time.
Mm-hmm. And how many patients do you think you might have treated in that 5 years?
Oh, that's a good question. I would say maybe 40, 50 patients have tried LDN.
Mm-hmm. And what have the results been?
So, this is the nice thing about LDN is there's very few people who have, first of all, I can't think of one person who's had any severe side effects. Most of the time, if people discontinue it, and this would be in like the 10 or 20% of people who discontinue it, it's because of insomnia or anxiety or anorexia, like lack of appetite, which for other people, they'd actually like that side effect. Mm-hmm. So for those people, and a lot of patients will have minimal side effects that affect sleep or affect mood and create a little bit of anxiety initially, but if they hang in there over a week or two's time, that will diminish. One way that I use to help that not be an issue is I start them with a very tiny dose. So I'll usually prescribe a 3.0 milligram tab to start and have them do half of that. And then they go up to the 3.0. And if they tolerate it, we can go up to 4.5, which is 3.0 and 4.5 are the most studied doses.
Mm-hmm. And what conditions would you say you have treated?
So the bit of research that we have so far is mostly on autoimmune disease and MS, Crohn's disease and colitis, sometimes pain syndromes, which can be a little tricky if patients are on narcotics because obviously LDN inhibits that. We have to dose and time the dosing appropriately. But really any other autoimmune disease, there's less research outside of MS and Crohn's disease, but I have used it in pretty much any autoimmune disease you could name. I've used it in those situations. Mood disorders in some people and difficult weight loss, those are other indications. I don't use those for those indications as much, but it definitely has the endorphins that it produces has a wonderful effect on the mood, and most people feel better, less depression, and that type of thing. I think the people who do have side effects are in the realm of those who already have high endorphins. And since that's not something we routinely measure, usually we'll see them manifest after we try the drug with either, like I said earlier, anxiety or even some sort of a mild mania, like hypomania, could be a side effect. But that's extremely rare. So it has a wonderful effect on the mood as well. They have done some studies in ovarian cancer as well. But I haven't used it in many cases of cancer at this point either.
Mm-hmm. And do you use LDN as a standalone treatment, or do you use it part as a protocol?
So great question, because it's almost always part of a complete protocol. So usually what I'm doing is while I'm using LDN to calm the immune system, I will be looking for underlying triggers like dysbiosis in the gut or a toxic exposure or some sort of a hidden infection, and I'll be treating those right alongside. But the people who, feel better on LDN, I will say for the majority of my clinical experience, it's not a dramatic, like overnight cure. It's little by little over time, people notice effects. And for some people, it really will turn on the brain. So that's another neat effect, because when you block that opioid, people feel less sleepy and more on tune. And so there are people who use it just for, focus, concentration, and that. And then another effect I didn't even talk about was for the bowel, because opioids block the bowel motility. Just like if you've ever been post-surgical and been taking morphine or oxycodone or any of those drugs that help with pain, those obviously cause a lot of constipation. So there's a whole other subclass of patients who have small intestinal bacterial overgrowth, or SIBO, as we call it in the U.S., and those patients benefit from LDN because it actually helps with the migrating motor complex in the small bowel and assists with motility. And with patients with SIBO, one of the underlying causes of that is poor intestinal motility. So they really have trouble with sluggish bowels, and that leads to kind of a buildup of this bacteria in the gut and creates lots of problems. So that's a little bit different than the autoimmune disease, but it's a very effective way to use it.
Yes. And do you use any vitamins or supplements as well in your regime?
Oh, yes. Those are my tools. So typically patients are on multiple things, anywhere from, and it really depends on the patient. With the gastrointestinal, like Crohn's or colitis or SIBO, I usually have them on some antimicrobial herbs, garlic, oregano, caprylic acid, undolicellic acid, all kinds of things like that. We usually have them on fish oil and basic vitamin D, multi-mineral, multivitamin. And then depending on the situation, say we're dealing with an autoimmune disease, we may use things like curcumin, resveratrol, and alpha-lipoic acid, other things that support the mitochondria and support inflammation.
Well, that's interesting. So what would you say to somebody that is listening that has an autoimmune disease and they would like to approach their doctor? How would you suggest they would go about it?
Yeah, well, that's one reason I decided to write the blog article, because I wanted to take, and what I always like to do is make it in terms that any person can understand. They don't have to be a physician, but also to bring the research, and so that anything that I'm writing, I want to make sure I back it up with what studies are out there, because that way, if they ever present my article or anyone else's article to a doctor, the doctor is usually looking for research. And the difficulty is we don't have any large randomized controlled trials yet, but hopefully those will be coming in the future. But what research we do have for safety is it's extremely safe. I just feel like, except for the occasional insomnia or anxiety or vivid dreaming can be a side effect. But again, those aren't usually very serious, and so patients tolerate it quite well. And what I've seen clinically is either patients have a very dramatic effect over time, where they do just profound, like in MS or in Crohn's disease, so those things start to calm down and they maybe go into remission. Or we have patients who just have no effect at all, and over a few months' time they decide, I'm just going to quit this because I don't notice any difference. And I would say there's maybe 20-25% of patients that really don't notice a difference, but at the same time, they don't have side effects either, which is very nice. And so if patients haven't been noticing any improvement on their autoimmune condition or on their pain, then certainly we can stop the LDN. But for most people, over time, they get more and more of a benefit.
So I would just like to ask, do you do telephone consultations or just face-to-face consultations?
Yeah. I do. I prefer to see a patient in person the first visit, but then I do I see people all over the United States, so I do Skype and phone follow-up. And I have made exceptions for some patients who are really sick or unable to travel, where we do the first consult by Skype, and that's doable as well.
And how can people get hold of you?
My website has all kinds of stuff, and that would be the easiest way, and that's just my name, Jill Carnahan, JillCarnahan.com. And again, there's all kinds of free resources and things there. I do a free newsletter that goes out about every month, just with all kinds of things like this article on LDN and free recipes and things just for people who are interested, and that's on the website as well.
Talking about free recipes, what are your thoughts on, a gluten-free, dairy-free diet?
Oh, such a good question, because more than pills and supplements, I find the food is medicine, and I think the foundation of any good treatment is wonderful, good, whole, organic unprocessed food. Most of my patients, as we're talking about autoimmune disease, I do have on for sure gluten-free and dairy-free and sugar-free, and most of the time alcohol-free. And for some patients, they actually are completely grain-free as well. What we find with grains is because they're more processed and they do affect some of the bowel disorders and some of the dysbiosis or abnormal, say someone has bacteria or candida in the gut, that will be affected by those processed grains. But another thing I think where people are getting on the bandwagon with the grain-free diets and why it might be helpful is because, especially in the U.S., I think Europe has less of a problem. But here in the U.S., most of our grains are highly contaminated with mycotoxins from molds. And a lot of people are very reactive to that, and those are damaging to the gut. In addition, our corn and soy and wheat is all processed with glyphosate and Roundup, which is a chemical that's extremely toxic to the tight junctions in the gut. So the things that seal the cells so that we don't have permeability into the immune system and into the bloodstream, those are broken down by chemicals that are used in the agriculture business in the U.S. So again, there's multiple reasons. If we were growing our own, heirloom type of grains, it might not be such an issue, but our typical processed U.S. grains are a big problem for most of my patients.
Wow. I had no idea it was as bad as that. Right. Okay.
Yeah.
Sorry.
Well, I was just going to say, you guys have such an advantage because most of the European states do not allow genetically modified foods, and those are a huge source of these chemicals. And we've even looked at studies compared to European and Americans and their levels of glyphosate and chemicals, and Americans are always way higher. So sadly, we're at the other end of the spectrum over here.
Although after the last conference, so that's 6 weeks ago, I've been gluten-free, dairy-free, and sugar-free. I've lost 10 pounds, and my stomach feels a lot better. I used to have anti-acid tablets because I had reflux, and I don't have that issue anymore. That has gone. So I'm quite pleased.
Wonderful.
I don't think I'll ever go back. I think I'll stick to it now.
Good for you. Well, and if I might insert, just because I think this is valuable to your listeners, my story was in medical school. I was diagnosed very suddenly with breast cancer, treatment, radiation, chemotherapy, surgery, and got very sick. I was only 25 years old, but I beat the cancer. And then shortly after, about a year after that, I was diagnosed with Crohn's disease, which is inflammatory bowel disease. So, and I'm in remission from that as well. And I myself take LDN. I found it to be extremely helpful, like you have. And so I just can't say enough about that. But me personally, I have been completely grain-free for probably 10 years, and it really is a part of why I'm healed and doing so well. And again, not everybody has to do that, but especially the gluten, as you've noticed, most people who have autoimmune disease do much better on a gluten-free diet.
Yes. Thank you very much for sharing your experience with us.
Sure.
Do you have LDN experience to share? If so, please email me, linda@ldnrt.org. I look forward to hearing from you.